This special edition of South Sound Seniors is being presented in association with the Senior Action Network, joining forces to celebrate live.
Well, as most of you know, the open enrollment for Medicare plans is right now all the way through December 7th. And if you're scratching your head wondering, well, what does that mean for me? Our next guests are people who are going to help us with that question. Right beside me, I have Merridee Anderson from the Lewis-Mason-Thurston Area Agency on Aging. Welcome, Merridee.
Thank you.
And Bob Lien, who has been in our community for a long time, working different avenues of insurance, but right now he is an independent insurance agent, and he works for the Northwest Insurance Agency. Welcome, Bob.
Thank you very much.
Okay, well, you know, I always say, pretend I don't know anything. And this time it's pretty clear we don't have to pretend. So I know it's open enrollment. I know there's a lot of plans out there for Medicare Part D, and there's a lot of confused seniors. So help me understand what the issues are. So Merridee, do you want to go first?
Well, I think one of the issues that seniors have is every year they are inundated with a lot of information from a number of sources, and it just really overwhelms people. And so they need to go to someone such as Bob or myself just to get someone to sit down with them and go, okay, no, this is just an advertisement. Okay, this is from Medicare. You need this. Another thing is that there's always a decision of whether or not you want to go with something which is called an Advantage plan, such as Humana, Secure Horizon, Group Health, or what they call a Medigap plan, and there are many of those. Group Health, or I'm sorry, AARP, Globe, Primera, United Healthcare, many of them offered different prices and such, and people don't understand the difference. And take it away, Bob.
Right. Well, you know, I think there are 10 things that the seniors need to know about Medicare. And you touched on, basically there are two ways to get your Medicare. And that's going with original Medicare or a Medicare Advantage plan. And once you've made that decision, there's a number of plans and choices available to them. Number two, there is drug coverage available through Part D. So again, some of the Medicare Advantage plans include the Part D all in one plan. If you're on a Medicare supplement or Medigap policy and you want prescription drug, you have to buy a standalone Part D program. Remember, you're going to pay a share of the cost either way you go. And remember, it may be larger than you expect. Particularly if you're on a Medicare Advantage plan and you're having a lot of doctor calls or, you know, surgeries and that type of thing.
Okay, so I'm going to stop you for just a second because I'm already kind of fuzzy-headed. So first thing is which between the Medigap or the Advantage plan.
Correct.
And in my lay language, to me the Advantage plan then is if you go with a Group Health where kind of everything's wrapped into one for the most part, right? Okay, so Medigap is where you're getting something to supplement your Medicare with. And
correct.
So
yeah, Medigap policies pay second to your original Medicare.
Okay.
Yeah. Typically Medicare will pay 80%, and then your Medigaps will pay 20%. And in the Medigaps, of course, there are a number of options as to how much coverage you want or need.
Okay.
And there's different prices, but they're all kind of standardizing out now. So
okay.
it's and then again with those you have to buy a prescription standalone drug plan.
Okay.
And in this, I believe there are 40 of them available here. So
quite a number of standalone Part D plans available. Also, it makes a difference where you live.
Oh.
Because the options could be different between, say, Mason County and Thurston County and Lewis County.
Okay.
And of course, Centers for Medicare Services determines which plans are available by zip code or by county.
Okay.
So very important where you live is you want to make sure you're looking at plans that are available in your area.
Okay.
Of course, Medicare doesn't cover all the expenses, and so you'll find that there are some things that Medicare won't cover. But we are still early in the open enrollment period, or the annual enrollment period, so I recommend that people do the research, don't put it off.
Yeah.
And remember, you have a choice every year to make a difference or change a plan. And don't be afraid to ask for help. So if you need help, talk to the area agency on aging,
Right.
or the SHIBA program, or to a professional agent. We are here to help you to determine which plan is going to best fit your needs.
Okay. So how do people find out? The Area Agency on Aging number is published. Do you want to give the...
Yes, and the Olympia office, you want to call 664-3162, extension 133. And in Thurston County, on Thursdays and Fridays, every Thursday and Friday, all of November and into December, the first week of December, during open enrollment, we will be having clinics at the office on Harrison from 10 to 11:30 in the morning and 1:30 to 3. There'll be space for 5 people. There'll be laptops. We're partnering with the insurance benefits advisors through the Office of Insurance Commissioner. We'll have volunteers so we can walk people through it on a one-on-one basis, but in a group setting. We can also talk about the extra help that's available to people. If you are low income, if you're a single person and you make below $1,365 a month, and I believe if it's married it's $2,188, and then have resources, there's a cap on those, you may be able to get your prescription drug plan costs covered, or at least partially covered, even if you're on an Advantage plan. So it doesn't matter if you take traditional Medicare and a standalone plan, or you go with an Advantage plan, that's available. The state also has a program called Medicare Savings Programs, and there's 4 levels of that. 3 levels. For low-income people that will pay your Part B premium, which this year, in 2012, this year it's $115.40, and I believe it's going to go up with the raise.
Medicare and Social Security will be announcing that this week, so stay tuned. Even though Social Security retirement is having a cost of living increase of 3.6, you can just imagine they're going to increase the Part B premium as well.
Medicare, yeah. Okay.
So, and they can contact our agency on aging, again, in Thurston County, 664-3162, extension 133. Or I'm in Mason, 427-2225, extension 101. And Serenity is in Lewis, and her number is 748-4464, extension 101. And any of us, we can even do it over the phone sometimes. But call your local office. Come in, we're all going to be having clinics in our local offices. Call someone like Bob or an independent insurance agent near you and sit down.
SHIBA, I know, is also having clinics around, so you can call Senior Services 586-6181, because we are every Tuesday and Thursday having clinics here with SHIBA volunteers as well.
Good.
So yeah, the more access to those wonderful trained volunteers, the better. Yeah. So again, I think there are a couple things you said is, number 1, don't panic.
Right.
But number 2, don't wait until the 6th of December. That earlier you can get out there and get your questions answered. Now, I understand you actually will sit down with a counselor at times and sit and look on the Medicare site on the computer.
That's
and look at what the different plans are and what their needs are, their medication list, their
Right. We would recommend that when you come in for help that you have your red, white, and blue Medicare card plus a list of all your prescription drugs so that we can access the Medicare.gov website, because that will tell you which of the plans cover all your drugs and then what the premiums are for the various plans that are being offered.
So you can make an informed decision. That's
Yes.
the bottom line there.
Absolutely.
Yeah. Okay, and I imagine that informed decision is going to be very different for every single
Yes.
person. in
One
their
thing I would
situation.
stress is very often a husband and wife will say, well, we'll go with this. Not always the best decision. That's great with life insurance and auto insurance. In this instance, it's a very individualized, based mainly on, largely on your prescriptions if you take them. So it's important for spouses, partners to look also at individual counseling so that they make an informed decision, because I don't know how often I run into one of them's doing great, the other one will hit that gap and start paying the 50% of the full cost now and really run into some financial difficulty. So
Yeah.
Yeah, to get a little more detailed into the 2012 basic drug plan, the calendar year deductible under a basic plan will go up to $320 for this next year. So you got to pay the first $320 of your prescription drugs. And if the cost of your drugs, including your co-pays or co-insurance that you pay, reaches $2,930, that is when this coverage gap or donut hole begins.
Okay.
And as Merridee said, if you reach the coverage gap this next year, on your brand name drugs, you're going to get a 50% discount. And on your generic drugs, it's a 14% discount. But you have to be in the donut hole in order to receive that. And then if you get up to the 4,700 limit, that's when the catastrophic coverage begins. And the drug plans will pay 95% of your drug costs, and you would pay 5% or the co-pays, whichever are higher,
Okay.
on that. So very important that if you need prescription drug coverage, that you take a look at this, because if you don't sign up when you're initially eligible, there's a 1% penalty for every month you delay getting into a Part D program.
Right.
And that's based on the basic national drug premium here in the U.S. And I believe it was about $33 this year.
it was.
Okay.
And,
Yeah.
So say you're somebody new just starting into Medicare and you think, oh, I don't take that many prescriptions, I don't go to the doctor that often, I'm not going to bother signing up for this. You may want to rethink that. And even if you get the lowest cost thing, it may save you money in the long run because you won't have to deal with those penalties. So definitely call. Don't just put it off because you don't take medication.
It's another thing I'm running into this year too, which I hadn't before, is I'm getting a lot of people just turning 65, and the Part B is the same way. If you do not sign up for Part B within 63 days, I believe, of becoming eligible, there again, there is that same penalty.
There's a 10% penalty
Yeah.
on Part B.
So it will go up very quickly.
Yeah.
So, and look at that carefully. And that is when you get your Medicare card, it's inside of a little square deal. That's where you can opt out of Medicare Part B if you don't want it. Like if you're working already and you have creditable insurance coverage, you don't have to get it.
Okay. And
You
don't
can
get
put it up,
penalized.
and you do not.
Right.
So you want to sign that and say, no, I don't need it right now.
Right.
So be sure to
Very,
look at that.
very important, because more and more of my 65-year-olds are not retiring, so they're still on their employer plan.
Right.
It's very critical that they have credible coverage, and what that means, it has to equal or exceed the original Medicare benefits.
Okay.
because a lot of the companies, are going to these catastrophic plans and high deductible, and those usually do not meet the credible coverage definition. So
you have to really be careful.
Yeah.
So I think the bottom line is call.
yeah,
Call your
Just
company.
assume you know what's going on. Yeah.
And your employers will give you a letter stating you do or do not have creditable coverage, and hang on to that letter. Because down the road, if they want to try, you can say, oh, no, I had this, and that will take care of it.
Yeah. Okay.
So,
Well, good advice. Call early, get all your questions answered. It's really a lot of confusion, but it can be straightened out, so don't panic.
right.
Okay. Thanks so much, Bob. Thank you, Merridee. Really appreciate. This again was a program that was primarily put together by the Senior Action Network, and we thank the SAN group as well as our wonderful volunteers, TCTV, and our producer, Vaude DeVille. So thank you so much, and we'll get back to the studio now.
This special edition of South Sound Seniors has been presented in association with the Senior Action Network, joining forces to celebrate life.